As we spend a significant portion of our daily lives at work, it's crucial to recognize the toll that workplace stress can take on our mental and physical health. Yet, all too often, we ignore the signs of stress caused by various pressures in the professional environment. It's both tragic and timely that the recent death of a 26-year-old professional, reportedly driven by the intense demands of overwork and a culture that glorifies long hours, aligns with this year's World Mental Health Day theme, which is it is time to prioritize mental health in the workplace. During a recent workshop we conducted with professionals from a range of organizations in Delhi, many participants highlighted that long working hours, tight deadlines, and high performance expectations were key contributors to workplace stress. Additional factors such as excessive workloads, lack of control, monotonous tasks, role confusion, poor recognition, and strained interpersonal relationships further exacerbate the issue. Sexual harassment and bullying only add to the mental strain. It's important to note that stress doesn't just lead to mental health challenges like depression and anxiety, but can also result in physical conditions such as hypertension and diabetes. Despite the clear need to address these issues, mental health in the workplace remains an often overlooked priority across industries in our country. Prioritizing mental health in the workplace is crucial for several reasons. One is employee well-being. I mean that ensuring employees' mental health is supported leads to healthier and happier individuals who are more engaged and productive. Two, productivity and performance. Mental health issues can significantly impact an employee's ability to perform effectively. Addressing these issues can lead to improved focus, creativity, and overall job performance. Three, reduced absenteeism. Mental health problems can often lead to increased absenteeism. By supporting mental health, organizations can reduce the number of days employees take off due to stress, anxiety, or depression. Fourth, workplace culture. A focus on mental health fosters a positive workplace culture where employees feel valued and supported. This can enhance team cohesion and morale. Fifth, retention and recruitment. Organizations that prioritize mental health are more attractive to potential employees and are more likely to retain their current workforce. This can reduce turnover rates and the costs associated with hiring and training new employees. Sixth, legal and ethical responsibility. Employers have a duty of care to their employees. Supporting mental health is part of their responsibility and can help avoid legal issues related to workplace stress and mental health discrimination. Finally, which is related to all the points above, is economic benefits. Investing in mental health can lead to significant economic benefits for the organizations, including reduced healthcare costs and increased productivity. By creating a supportive environment, organizations can help their employees thrive both personally and professionally. These initiatives, of course, influence one's well being. For instance, physical activity and nutrition are closely linked to an individual's mental well being. However, we should go beyond what immediately meets the eye and develop long term sustainable workplace programs. A few examples of what organizations can do to improve employee mental health and well being are professional mental health counseling services, which can be either face to face, on site, or take place virtually or telephonically. There should also be specialized support and counseling services for employees to deal with death, loss, and grief. Like a healthy and physically fit program, a Healthy Minds initiative by organizations should include discussions and webinars on well being, stress management and reduction sessions, and in person or virtual yoga and meditation sessions. We can talk more about this as we go along the conversation.
Some model organizations have policies in place to address workplace stress and promote a healthier workplace for their employees. They are not in any order of importance here. However, implementing as many of these will have a compound effect. The first is to have flexible work schedules where employees have the choice of opting for flexible work hours or remote work options to balance their personal and professional lives better. For instance, employees have varied caring responsibilities for children and aging parents to take care of. Second, employees should have basic education and training on mental health that particularly focuses on issues related to identifying workplace stress and its management. This helps employees recognize and manage stress effectively at an early stage. Thirdly, having a supportive work environment where employees feel valued and appreciated. This is shown to significantly reduce stress and includes recognizing achievements, providing constructive feedback, and fostering open communication. For instance, many organizations have a recognition and reward program that awards employees for outstanding performance. Related to this is that organizational policies should reflect a visible support from leadership, where senior leaders and managers actively support mental health initiatives, helping to create a culture that prioritizes employee well being. Fourthly, as many organizations offer wellness programs that include activities like yoga, meditation, and fitness classes can help employees manage stress and improve their overall well being. Fifth, organizational policies that offer paid time off and leave policies ensure that employees have access to leave, including sick leaves without any penalty. This helps employees to take necessary breaks to manage stress and burnout. Sixth, organizations can adopt workload management policies to effectively deal with workload and prevent overwork. This includes like setting realistic deadlines and ensuring employees have the resources they need to complete their task. Seventh, which is now increasingly being taken up by many organizations, is to provide channels for anonymous feedback systems that allow employees to report about workplace stress that help higher management team identify and address issues proactively. Along with many of these policies that the George Institute has in place, it has a strong policy on implementing the Prevention of Sexual Harassment Act, that is the POSH Act, and has zero tolerance for sexual harassment in the workplace. Additionally, it takes workplace bullying very seriously and has a policy on employee respect and dignity. It also follows the principles of diversity, inclusiveness, and belongingness and incorporates these across different organizational policies. It allows employees to enjoy an additional 3 gifted days of leave during office closures, providing them with more time to rest and recharge. Other simple things that the George has been doing are organizing wellness activities, providing healthy fruit snacks in the office, adding plants, improving lights, or creating quiet zones, organizing social interactions and picnics, team building activities, and regular check in and feedback sessions. I would like to mention a few organizations that have prioritized mental health in the workplace, which have actually shown encouraging results. I do not speak as a spokesperson or promote any of these organizations. I put this as a disclaimer. SAP SE, a German multinational software company that has implemented a comprehensive wellness program that includes mental health resources, physical fitness initiatives, and flexible work arrangements. Google is known for its innovative workplace culture and offers its employees a range of wellness programs, including on site fitness centers, healthy food options, and mental health support. Zappos, an online retailer, emphasizes a fun and supportive work culture. They offer wellness programs that include fitness challenges, mental health resources, and flexible work schedules. Houston Methodist, a healthcare organization, has implemented a robust wellness program that includes mental health support, stress management workshops, and physical fitness initiatives. Motley Fool, a financial service where stress is supposed to be extremely high among employees. It offers a variety of wellness programs, including mental health resources, fitness challenges, and flexible work arrangements. These initiatives have helped create a positive and a productive work environment, contribute to high levels of employee engagement, satisfaction, and productivity, improved employee health, and reduced absenteeism, and high employee retention rates. These examples demonstrate how investing in employee well being can have a more productive and satisfying workforce. Government policies addressing workplace stress has had a significant impact on employee well-being across different countries. I just point out a few examples of a few countries out here. One in countries like Denmark and Sweden of the European Union, national legislation addressing psychosocial risk has led to improved workplace environments. Employees report lower stress levels and higher job satisfaction due to mandatory risk assessments and proactive measures. Japan has annual stress checks, which mandated by the government have helped identify and mitigate workplace stress. This policy has led to better mental health outcomes and increased awareness of stress management among employees. In Australia, the Mentally Healthy Workplaces Initiative has provided resources and training for employers, resulting in more supportive work environments. Employees benefit from reduced stress and improved mental health due to these comprehensive programs. In Canada, the National Standard for Psychological Health and Safety in the Workplace has set a benchmark for mental health practices. This has led to a more structured approach to managing workplace stress, resulting in better mental health support and reduced stigma. In the United States, OSHA, that's the Occupational Safety and Health Administration, guidelines and the Mental Health Parity and Addiction Equity Act have improved access to mental health services and created safer work environments. Employees benefit from better mental health support and reduced workplace stress. Going back to what I started my discussion on, or what the discussion initially started on, the Indian government can do a lot in having policies that prioritize mental health in the workplace, like the POSH Act, which favors women more, though there should be mandatory and legally binding guidelines to address workplace stress and improve workers' well-being.